So radiation causes side effects, and local doctors will see patients who have side effects from radiation treatment. So I'll talk about some of the short-term and long-term side effects that men might experience and talk to their local doctors about. The short-term side effects of radiation are practically always self-limiting, and they're rarely serious, but they can be irritating for men. It causes irritation of particularly the urethra and the rectum with the radiation dose, and that can cause bowel and urinary urgency and nocturia and dysuria, and typically they can just be treated conservatively with medication, and they will get better within usually a week or two after the radiation treatment for its external beam. In the case of seed brachytherapy in particular, the local side effects can persist for 1 to 2 or 3 months, and most men will need to be on drugs such as Flowmaxtra to improve their urinary flow because of the effect of the brachytherapy on the prostate and on the urinary flow. In the long run, all these short-term side effects go away, but there is a risk of long-term side effects. So the tissue irradiated can be damaged and cause side effects in the long run, and most of these are transient and not very bothersome, although they might come and go over the years. But in some men, they do get troublesome symptomatic side effects that they would seek help about, and these can generally be managed conservatively, but if they become bothersome enough, for example with rectal bleeding, the important thing is that men need to be examined and perhaps endoscoped to establish a diagnosis to show that it's due to radiation proctitis, the radiation damage. And if that's the case, then it might be that the proctitis can be treated with argon laser treatment. If the bleeding becomes serious and frequent, then hyperbaric oxygen treatment is often very, very effective. An important thing to convey about men who have bleeding from proctitis after seed brachytherapy is that this should never be biopsied without first talking to the radiation oncologist, because it can precipitate very serious side effects. These side effects are very uncommon. They're of the order of 1 or 2 per 1,000, but the side effects can be devastating for the guy, and so biopsies of bleeding areas over the top of the prostate should be avoided. So another side effect of radiation is the effect on the bladder, and this can cause radiation cystitis. This is again a rare problem to a serious extent, but it can cause bleeding per urethra with micturition. It's usually self-limiting, but in some guys it can evolve into a very serious problem, and in these cases the cause needs to be first of all established by cystoscopy and exclusion of other more serious causes, and then manage cystoscopy in the first instance by local treatments. And if the problem becomes persistent and increasingly troublesome, then hyperbaric oxygen might be used, but for a very small fraction of men who have this problem and it becomes intractable, then they might have to have a urinary diversion. The other thing that can happen with the urinary tract after radiation treatment is problems with obstruction, and this can be perhaps due to either strictures in the urethra, and these can be problematic and need to be managed as conservatively as possible, because with surgical incisions and urothotomies, these can cause problems with incontinence. And so it's important to try and be as conservative as possible with the management of these, with just dilatation if possible. The other thing that happens is just continuation of benign prostatic hypertrophy after radiation treatment and obstruction at the prostatic level. And this can be managed with TURPs, but we need to be very careful and conservative about treatment there, because treatment with TURPs can cause problems with the prostate and also continence. And so it's important after radiation treatment, when men develop obstructive problems, that it's managed as conservatively as possible. And one might find that aggressive surgical treatment would be normal in men with normal prostates, can cause problems with incontinence with surgical management after radiation.
So surgery comes with its own suite of side effects. It's quite a large surgical operation that patients go through. So there are obviously acute effects in the pelvis. Bleeding is an ever-present risk. Most men get some blood loss. Most often they don't need a transfusion, but their hemoglobin might be lower. They may be lacking in energy post-operatively. Infection similarly is a potential risk. The wound itself can cause problems, particularly relating to pain and impairing activities, and particularly men who return too early to aggressive physical activity, the development of hernias. In the immediate recovery from surgery, men also have a catheter in place, and quite often they get home with the catheter and then return to have the catheter removed. So catheter-related problems and the management of the catheter may require a little bit of support. The scale of the surgery obviously also puts men at risk of other medical problems, heart attacks, anaesthetic risks, venous thrombosis in the lower limb, and pulmonary emboli and similar. Thankfully, major complications and issues are rare, but when they occur, can have a devastating effect on men. The long-term side effects of surgery, once they've recovered from the surgical procedure itself, that most concern men are incontinence, and certainly most men who have had surgery will pass through at least a period of having incontinence and need to manage that. Again, various incontinence aids may help that process, and depending a bit upon their age and other effects on their urinary function, most men will regain continence, and the percentage that are left with longer term incontinence ranges from 1 or 2% in younger men to up to 10 or 15% in older men. Impotence and other related sexual dysfunctions, such as loss of ejaculation and painful orgasm, also bother men, and this is related to nerve damage and impact on sexual function. Again, there can be recovery over time. Again, there is a significant impact of age as well as comorbidity on this, and whether or not nerve sparing has been undertaken also determines the ultimate outcome. Typically, this can take a number of years and may require additional treatment with agents such as oral agents as well as injectable agents. And depending upon age, younger men can regain sexual function in 50 to 70% of cases, whereas older men might have far poorer outcomes. So in summary, side effects can occur from all treatments for prostate cancer. They're thankfully rare, particularly in their severe forms. And various specific treatments are available, which we've talked about to some extent. But probably the support provided to men is most important, and providing information and facilitating access to some of this. So Jeremy, maybe if you can talk to some of the initiatives that can help that process.
Yes, so what we find in talking to guys who've been treated for prostate cancer is that one of the most important things they say about the outcomes is how they're looked after in the long run and supportive care. And it's clear that we need to do a better job in providing care for men in the community after treatment. And so the PCFA has had a fantastic program of supporting prostate specialist nurses within health services around Australia, and these have been an important resource and contact point for patients with prostate cancer and treated for prostate cancer. And I think that they're making a real difference in the health services where they're working. There's also a lot of counselling services available for men with prostate cancer, but it's important that men can be put in contact with them through support groups or through the surgeon's practice nurses or the radiation centre nurses. But another thing that we've been looking at is with the Prostate Cancer Outcomes Registry is a program sponsored by Movember, which is called True North. And what we've done is looked at identifying men who have a big bother with the side effects after treatment with either radiation or with surgery, and phoning them with a dedicated prostate support nurse and asking them about whether they can be helped and what problems they have, and then using that long distance phone support to refer them to local resources where they can get specific help for their problems. And that's turned out to be actually a very cost-effective and useful way to look after men who are particularly having troubles.